Good afternoon, everybody. My name is Thomas Cotton, and I'm the founder and president of Redemption and Advancement Alliance. We're an organization that prevents incarceration and recidivism. Today, I'm going to talk to you about CBPR and community collaboration and data collection. It's so important to have community involved with academic research because sometimes researchers act independently in the community when gathering and interpreting data, and how they want to disseminate those results. And so being a part of a community coalition board that does CBPR, we find that there's a need for both the academic and community partners to be involved in data interpretation, dissemination, discussion, and making sure that the data is valid toward the communities we serve. And so today I'm going to talk a little bit about that and just tell you what key components of CBPR are. CBPR is a collective research approach that is designed to ensure an established structure for participation by communities affected by the issues being studied. And you can read the rest there, but key components of CBPR is the establishment of effective, meaningful, and mutual beneficial relationships and partnerships between community and academics. And it's basically being able to empower our communities to speak into the process of how data is going to be collected, how it's going to be disseminated. Is it even necessary to collect this data? How to connect with the community, the voice of the community to be able to share the research findings back to the community. So there's so many different things that CBPR bring to the table. With CBPR, there are 9 key principles based upon the base participatory research. And so those 9 key principles, number 1 is promotes collaborative and equitable partnerships. And when we think of academics and we think of doing research, usually it's the institution that has the upper hand when it comes to collecting data or research. But with CBPR, it promotes collaborative and equitable partnerships, meaning that the community is just as empowered to be able to share in the process, and that all parties share in control over how the process is being delivered or how we collect data. And just from the beginning to the end, it's an empowered process for everyone to be involved. Here's the interesting thing about the collaborative partnership is that both sides recognize the value of one another. I mean, there were a lot of stats that were thrown out there. Dr. Blumenthal put a stat down in the pod down here, and you read, and it's like 3 trillion last year, over 70% growth GMP. And so when we think about that, from my standpoint of community, that doesn't make any sense to me to go look for, because I'm working on boots on the ground trying to find support for our community. But then you add academics who this is their world, this is what they do, and it allows us to have this connection to understand that our partnership is both equitable and necessary. The next step is community is the unit of identity, meaning that there's a sense of connection and identification with others. It's a shared norm and values and common language and customs, which provide similar goals and interests and a desire to meet shared needs. So we're a part of the geographic area that's going to be searched or going to be studied. And we are the group with the common sense identity. You know, we understand the ethnic groups, the age, the orientation. We know our community. And so it's important to have community as the unit of identity. Number 3, it builds on the strengths and resources within the community. The one thing that's important to understand is in our communities, just because they're poor doesn't mean they don't have resources. There's strengths and resources in each community that allows us to assess the skills or assess the resources that are available. And so when we do this, we create helpful networks and social relationships that allow the studies to gather the information that's necessary to move forward. When we look at the granular data that's trying to be that's being collected through Moyo, it's important for us to have these strengths and resources within the community, because it helps the app to progress. It helps to get the necessary data that will help it be successful. But not only that, it helps to be able to have dissemination pathways within the community once the data is collected. The fourth thing is CBPR facilitates co-learning and capacity building among all partners. It's a transfer of knowledge and skills and capacity. When I first started with CBPR and the Morehouse School of Medicine Community Coalition Board, I did not know anything about CBPR. But being around the academics, being around the board, and then also going and doing a fellowship at the University of Michigan about CBPR, I began to understand how this is so important for us to empower organizations within our community, to empower people who have a passion to make a difference within the research that's being studied. And so it was just a natural fit for me to really fall into doing CBPR because it helps our communities in such a way that it brings a knowledge. And so when we have a co-learning and capacity building, not only do they bring a knowledge, but sometimes we get to the point where we think that community doesn't have anything to offer, and there's this misconception that community partners have limited expertise, but community partners have a great expertise when it comes to the things that they experience on a daily basis and how they can share that information with academics to help direct the research in a more laser-focused way, so to speak. Number 5 is focuses on problems relevant to the local community. Again, we have different things that allow us to focus right on our community. We have a CHNA, which is Community Health Needs Assessment, that is handed out within our communities so that we can find out what are the top health needs that are impacting our community. And so as we're going through the things that we're going to research and how we're going to impact these communities, we let the community first speak to us in order to be able to direct the research so we can make an app like MHealth, because we know that MHealth is important for the communities that we serve because heart disease is an important factor within our communities. So when we use CBPR principles, this allows us to go in and have some knowledge before we go and just start exploring. Number 6 is balanced research and action for the mutual benefit of all partners. Again, balanced research and action means that we commit to the translation of research findings and interventions and policy change strategies that will address the concerns of the community. When we think about this, like, how are we going to use this data to impact this community? I mean, we're going to go in and we're going to get this data, but if we're just getting data, then how are we going to use this? And that's been the way of collecting data for a long time. I remember before I got on the board, I would not, it was hard for me to trust people who are collecting data because it just seemed like you're just using us to get the data, but there's nothing that was going to benefit our community directly. When Dr. Taylor talked about the Heckler report in 1985, we see that they say that majority of the people are getting healthier and healthier, but our communities are still suffering. I would dare to believe that that report did not have CBPR principles being used, and because they were focusing on the places where they go and the people that they serve, but it wasn't getting disseminated to everybody. And so when I think of commitment to translation of research findings and having an interventive policy changes that can help our communities, it's important to have this. Number 7 is disseminating findings and knowledge gained to the broader community and involves all partners in the dissemination process. So the important part about dissemination, I heard a statistic before and someone could correct me on this, but usually when research is done and by the time it's published and everything else, by the time it's disseminated to the community, it takes up to 7 years, 5 to 7 years is what I've heard. Through the CBPR principles, it usually gets disseminated a lot faster because as the study's going on, the community is involved with it. The community gets to see the data. The community gets to hear all the feedback from the people that they work with, but also the academics. They're hearing both sides of academia as well as the community. And so being able to take the findings that we get through the studies, it's so much easier to get back to the community at a faster pace, more rapid pace. The other thing is, if research is publicly funded, it should be publicly available and influenced by the community that it's impacting. So The cool thing about having CBPR principles used is not only are we using our funding correctly to get the data, but we're actually giving it to the people who have a need and making a difference right away. The eighth principle is it promotes a long-term process and commitment to sustainability. Sustainability is so important to me when it comes to collecting data. We can always have the knowledge of the data, but what can we do with it? And sometimes the best thing that you can do is give it to people who want to make a difference in the area that has been researched, because then they could take this research and turn around and get funded to do something about this research. They can also partner with other organizations that could bring resources to the community in order to make a difference. But it helps to extend beyond just a single research project, and it goes beyond just a funding period, and the community gets a chance to own this, as well as partnering with higher education organizations, the CDC or whoever it may be able to make an impact in the community. So it creates the sustainability. And number 9, it involves using a cyclical and iterative process, meaning that it draws on all the competencies of each partner to engage in a process that includes all stages of the process. So there may be a research project that's going on, but then we'll have our full board speaking into it, and then we'll have these breakouts that allow us to talk more about it in depth and bring the information back to the board. And I can't think of the word right now, but you know what I'm talking about when you have a committee that comes and focuses directly on what's happening in the community. So there's this intentional aspect to CBPR that allows us to have this process to continually revise and continually work on the process. And so when we think about working within MOYO, we use the Morehouse School of Medicine Prevention Research Center's Community Coalition Board. That's a mouthful right there. Basically what it does is it serves as a community IRB, meaning that we have researchers, we have problem solvers, we have those who collect data in partnership with the community, because the community has the trust, they have the support, they have families, and so it allows us to serve as a community IRB. And we are able to look out for our community in a sense that, you know, if you're going to do collecting of the data, we want to make sure that, you know, we're doing it not to harm the community, but with being very intentional with helping the community. It's a community engaged process. So if we're not going to hurt the community, the best way to do is get the community involved. We focus on major health priority areas, and that's the CHNA that I talked about earlier, Community Health Needs Assessment. And then it leads to establishment or refining of PRC research, services, and training initiatives. Like I said, it always feeds back into being sustainable for the long term, because we don't want to just do research for the sake of doing research. You know, the interesting thing is when we think about researchers, there's a difference between researchers and community. A lot of times researchers have this pressure of being able to publish in certain articles at different times. And what we want to make sure that we're doing is not only allowing the publishing to take place, but taking the community's voices and allowing them to be published authors within the research findings that are there. So it's important to have that aspect. So it leads to more established or refining of research and so many different other things. And then how we disseminate the research findings is very important, because with getting the data is great, but if it's not getting out to the people, it's worthless. And so it's important for us to change policies with the data. It's important for us to change communities. And it's important for empowering people and organizations to know what's necessary to move forward. This picture kind of gives you an idea of what it looks like. So if we think about MOYO and CBPR, in the middle we have the community good, like what's good for the community. And then we have the brains and we have the heart. And so that we can see that the community is a heart that has brains, and the academic partner is more brains but has heart also. And so it's important for us to be able to connect together. So some of the collaboration benefits, and when we think about CBPR and its influence on Moyo, we work with the CCB, the Community Coalition Board, to develop the focus groups and the facilitator side. So how we uh, get our focus groups to do Moyo, the CCB helps to direct that through using CBPR principles. We come up with our recruitment strategy and identify pockets in our population that can really benefit from this. And then we have academics and community in one place, which is a beautiful thing. I mean, when you see people who have all these higher level degrees and they're coming into a room full of community, but the community is just as empowered as they are. And no one's like big I, big me. No one looks down on anybody. Everybody's voice is heard. It creates a place where we can really get things done, where there's camaraderie, and then it allows us to, really hone in on what we're trying to do with the work that we do at the CCB. Outside of the CCB, CBPR principles help to users to develop the interface for the Moyo app. And so what we do is we do a focused user-centered design, so meaning that we take the perspective of our target population and we engage them in order to assist us on development of the final products. So Moyo right now is in a beta phase, and so being in the beta phase, we continuously engage the target population through a series of events called health tech events. And in doing that, we were able to empower the community to understand the Moyo app. They're able to get into the beta phase, and then they're able to learn some different things. So what they end up doing is they take this prototype software, they develop the prototype, and then their feedback is used to develop the final user interface. So it's so important to have community involved in every aspect of how it should function, how it should feel, how it should look, and what it should do. This in turn will allow the users within our community to use this app in a way that's effective and a way that allows us to move things forward and grow with gathering this data and hopefully making a further impact. And again, you see some benefits here for collaboration benefits, but most of all, it joins us together with academics, us meaning community, together with academics.
Taking questions also from registration. So question one, and this is for both Dr. Taylor and Mr. Cotton, how are you effectively engaging marginalized populations around the use of mHealth interventions? Because there may be a school of thought that marginalized populations, low-income populations, or even rural populations will not effectively utilize mHealth interventions. So first question is, how are you engaging marginalized populations or populations who traditionally have access issues around the use of mHealth interventions?
Okay, well, I'll start, but I think a lot of what Mr. Cotton just finished saying is the absolute key to whether or not we're going to be effective. Um, First, sort of the answer that comes quickly to mind is that everybody knows that just about every single American has a cell phone. Um, and the vast majority of those phones are smartphones. So the question of um, having people have access to the instrument of or the channel for dissemination of information or for uploading important data, the potential is huge. And it transcends racial boundaries. That is, African Americans have about the same level of involvement with cell phones, the same level of commitment to social media, if not higher, and it just makes for a very fruitful, potentially, area for us to pursue. In terms of, but how do you turn that into actual usage for this very specific approach, a very specific need or area for impacting population health. That is something that a lot of us are interested in, and we are actively exploring. We feel very confident that we're going to be successful because we started by asking the people that we want to get involved. Going to the community first with the idea, hearing their input, actually involving particularly several groups of young people who were very animated, energized, and excited about co-designing an app that was designed to help them live better lives. Um, that was, I think, the first step in all of this. There are other people out there doing mHealth, clearly. Our approach was to first talk to the people we wanted to impact. That has been, I think, what has distinguished us. There may be others doing the same thing, and if so, I applaud them. But that has been our focus. Talk to the people you want to impact. Find out what would be acceptable, easy for them to use, and something that they would not just use one time and put down and never come back to. Those types of questions, guided by the PRC, Mr. Cotton, the advisory board, who helped us form the focus groups and so on. That has been the critical step. And this is an ongoing process because we are actively engaging people in the beta phase as citizen scientists to help us further refine our approaches and the features of the app and the Moyo network. In fact, they even picked the name Moyo. This was not something that came from the ivory tower and that came out of my head or Dr. Clifford's head, my co-principal in this, but it came from the community, and we're very grateful for that.
And the only thing I'll add to that is CBPR is that process that allows us to engage. And sometimes the CBPR may seem like an extra step to go through, going through the community. We can easily create an app and we think this is going to work for our community, but the importance is going through the community so we can know how to be successful. When it comes to innovation, innovation sometimes starts off slow. And people look at it a certain type of way and say, oh, I don't think that's going to be successful. But if we're very intentional about engaging our community, and our community is giving us back the data that we need to be successful, then in the long run, this thing will be successful because technology is only getting more and more accessible. People are getting more and more familiar with technology. And so through the innovations that we're creating here, it allows us to build a framework. Again, it's in the beta phase, but when it comes to the final interface, the community is going to have a loud voice in that. So what would you use? Yeah. First, you would have to find I would strongly suggest that you find an organization that's going to value your voice. One of the things that I appreciate about Morehouse School of Medicine's Prevention Research Center is they value our community coalition board to the point where our board president is a community member and will always be a community member. And so one of the first thing is to find an institution that's going to value your voice. The second is to do research on what CBPR looks like. So any organization that claims to be doing CBPR, you can definitely see if it's true or not, because there may be organizations out there that claim to do CBPR but still hold the power within the institution. And so that's going to be important. And then third of all, reach out to the prevention research centers, or if there's community coalition boards, do research in that and just reach out to them and talk about how you're interested in things that you would like to see happen in your community.
It's a great question. As I think you mentioned in the introduction, I'm a cardiologist who has been involved in epidemiology for some time now. And generally, the first lesson I had to learn in pursuing epidemiology was how to talk to epidemiologists, and that's people who specialize in not taking care of one person at a time, one by one, which is how I was initially trained, but rather people who were concerned about the whole population and patterns of disease across populations. That was the first sort of, for me personally, challenge but that dates back to earlier in my career. I thought that was a challenge, but eventually biostatisticians, epidemiologists, and other people who are not only specializing in um, the classic public health sciences, but other supporting sciences all came together as a team to make the Jackson Heart Study and projects like it work. Um, Interfacing with people who are so highly technical as engineers presents another problem. First of all, there's a language problem. There is a learning curve to understanding just exactly what the engineer is talking about. And from his side or her side, they have the same issue. And what it takes, and if you bring importantly community members into the mix who may have a whole different set of expert skills and interests and motivations, you get quite a challenge. And if you're not careful, everybody will be talking past each other. People won't recognize the challenges that the other group is facing. We may suggest something that sounds easy to us that may be impossible, or at least hard to do. Say, for instance, a lot of our participants would wanted an avatar as a part of the app. And it's a great idea to have this sort of human-like figure that's designed to look like you, be like you, have a lot of characteristics that you have. That's a beautiful suggestion, but it was cost prohibitive, time prohibitive, and something that we could not accomplish in time to get the app launched. So what sounds like a good idea, and everybody agrees, may not be practical. So my point being, a team takes time to develop. A team needs to work hard in communicating. A team has to approach each other with respect and patience. And that's something that we have learned, that we continue to learn. Um, and it is a dynamic process that will, I think, probably continue for the duration of this project. We'll continue to learn from each other, and most importantly, learn from the community as we get feedback on the adoption of the app and its impact on
Phenomenal.
the participants.
Mr. Cotton and Dr. Taylor, this question is for the both of
So
you.
developing a team and
Data,
getting
with
getting
data
the
being
languaging right
such a
and
huge
approaching
component
things with
and
patience.
even a revenue generator in today's society, how do you ensure that you develop a bi-directional model which allows the academic institution to benefit from the data which is being created from the app and community members from benefiting from the data which is being created by the app, whether it be Moyo or any other mHealth intervention which exists?
So I think when it comes to the benefit, again, CBPR principles being put in place and having a community coalition board that directs this research helps to disseminate the findings to both the academic institution as well as our community. And so by being intentional from the beginning, allowing community to be in a place of strength and not just a partner that sits at the table, allows it to be, well, we're very intentional about making sure that this will allow community organizations to benefit from, as well as academic organizations, that the research findings can be published, as well as they can be used for community grants or addressing needs that are within our community. So I think that's one way to make sure that it gets to the proper places that it needs to go, is to be able to empower others to have say on how it's going to be disseminated.
And I appreciate the question so much because not only does Moyo have to think about its own sustainability, we also want to be a vehicle for education, for people to learn about opportunities to access information about IT, even about the opportunities for economic advancement, certainly academic advancement. Our seminars and interactions with the community have featured those types of opportunities. Um, and I think it's important also that everybody know that, of course, the app is free, and importantly, it's open source. It's available. It is not proprietary. In terms of staying creative as this whole IT world and digital world evolves about how to monetize or gain funds from this activity, we will be in constant communication with the creative people who can devise ways that could feed back into Moyo to keep it alive. But even as we consider those things, it's important to remember that the community is right there. So they will be involved in anything that we develop that might have financial or monetary implications. And they will reap the benefit. The goal is to reap the benefit. This is all about improving health of historically marginalized populations. So every step we take, every action we consider is done with that in mind, whether it's from how the app looks to what the ultimate impact on health is. So we and again, watching our every move and being there to help us make the
Thank you.
right
So we're coming down to our
discernments and
final few
decisions
questions.
are very
Question for Dr.
activist
Taylor and
members
or
of the
Mr.
community.
Cotton.
So
Can you
with
please
their help,
speak
I
to
think
how
we
community
won't go
health
wrong.
workers can be involved in the app development process, the data collection process? Essentially, how can community health workers be involved in the use of mHealth interventions, whether it be from the perspective of Moyo or from an mHealth intervention overall?
Sure. And this is an area of, again, great opportunity and creativity, and Moyo is just beginning to consider this type of thing. So Dr. Clifford, who is, as I mentioned before, my partner in this enterprise, he's an engineer himself, has already active an intervention actually in a hard to reach population in Central America, wherein community health workers, many of whom cannot read or write, use a cell phone as a means of monitoring pregnancy and helping people through pregnancies in a part of the world where infant mortality is extreme and has already shown impact in that environment. We're actively discussing what are the implications for marginalized populations here in the U.S. of combining the power of the cell phone with community health workers to improve the human technology interface and to actually not just receive data, but to push out health information and even health care and in an early warning kind of a model, as well as advising people on the day-to-day issues related to pregnancy. So that's just one example, and there are many others that you can imagine. We're actively considering those as we further develop plans for Moyo's future.
Yeah, and community health workers, when it comes to collecting data, they are uh, basically our champions in the community. And so they help with getting information out, finding out different groups we can go and present to. So yes, they are of utmost importance. Through the Prevention Research Center, we have community health
Phenomenal.
workers within the community, so they're boots on the ground. So it helps out to be able to bridge some gaps that are necessary.
I didn't mention it specifically, but they were also a key, they played a key role in the early success of the Jackson Heart Study as well. And
Great.
so
So our final
we
question, and
look
then
forward to
I will ask
working
you
with
both for
community
your
health
closing
workers as,
thoughts.
again, as we go
Dr.
through
Taylor, for
latter
those who
stages
are
of the
interested
development of
in
Moyo.
collaborating with Moyo, how can they do so? And for Mr. Cotton, for those persons who are interested in collaborating with the Morehouse School of Medicine PRC, how can they do so?
I'm so glad to get that question. First, you can go to moyohealth.net, moyohealth.net, to go onto the website and get some introductory information about who we are and what we were trying to accomplish. Secondly, you can also email, and I'll give you my own email, which is htaylor@msm.edu. Um, Please, in the subject line, refer to this webinar, and that will be very helpful to me. I'm very excited to collaborate. Moyo, as I said, is something that we are giving away, and we're trying to pull in as many collaborators as possible to make it successful. So I look forward to your looking at the website and even emailing me if you get a chance.
So to connect with the Morehouse School of Medicine PRC, I just sent a link right there. You can look it up online to get more information about the PRC. You can reach out to, you can go on Facebook and look up MSM PRC, and you can find more information. There'll be information there that'll allow you to connect with the Prevention Research Center. I'm sorry I don't have a phone number for you right now, but the link that I just sent, if you didn't see it, it's in the question and answers at the bottom. And again, you can go
Additionally,
on
for those who are
Facebook and
in the
look up
Atlanta area,
MSM
there will be a
PRC,
CBPR
and you can
workshop
find
on April
our
25th
Facebook page
at
there
1
and be
p.m.
able to
at
connect with us
Atlanta
directly.
Technical College. So if you're in the Atlanta area, you can go to Atlanta Technical College on April 25th at 1 p.m. and you can gain access to the PRC there and get some information about CBPR.
Dr. Taylor?
Well, okay, quickly. First of all, thank you for this opportunity. Moyo is, for me, as a cardiologist and academic, is in many ways a continuation of what we started in the Jackson Heart Study. That is a response to the disparities that is specific and focused on marginalized populations that is guided by the community. Those things are ideas that are talked about frequently, but we are really trying to breathe life into that in a very practical way. Um, it's more than an academic exercise, however. This really, I believe, given the power of cell phones, given the fact that there are people who are deeply involved and engaged with the use of cell phone technology, that this is an open door that we, as people concerned about the healthy futures of our kids as well as ourselves, that it's a door that we should walk through and embrace the technologies all the way. I think it holds great potential, and I'm excited about the future. And specifically, I'm excited about Moyo, and I hope those of you out there who are interested will get in touch with us and see how you can join our efforts.
And so I would say, as a final thought, that the research and the data that's collected is so important for our communities. I mean, it helps to meet the community demands. CBPR helps to meet the community demands for research and address locally identified needs. And so if we're looking at these needs and we're identifying these needs, it's important for us to work together because community has a strong voice. There's dignity within our communities. Our communities may look like they're poor. They may look as if they have no resources, but the people are the most important resource that we can ever connect with in our communities. They have a wealth of knowledge, of history, of experience with the data in the or the issues within the community. So it helps to direct the data collection. It improves the quality and validity of the research also because we're actually making an impact where impact needs to be made. And so when we're looking at relevance and usefulness of all research for our partners, CBPR is an important rationale, important part of the rationale to move forward and work within these communities. The other thing is, when we look at communities, some of the communities we serve have been hurt by researchers in our history. Dr. Taylor talked about the syphilis research, the Tuskegee experiment, and just different other things that we know. And so by allowing community to be a part of the research, it builds trust and it helps the people in the community understand that this institution is for you, not just trying to use you.
Dr.
But if you're
Taylor
going to use
and
me,
Mr.
let me
Cotton, I
use you.
thank you
Just
for a
don't misuse
highly
me because I won't
informative and
misuse you.
engaging webinar presentation. And I thank each of
Great.
the attendees for attending today's webinar. Again, on behalf of the Morehouse School of Medicine Prevention Research Center, we thank you for attending part one of our Prevention Works webinar series.